Hello, everybody. This is Dr. Magarelli at CNY, Colorado, welcoming you to our regular Tuesday discussion. And today's going to be question and answers. You have questions. I certainly have answers. Hi, IVF Still Hope. Got you there. Good to see you. Icy for sure. Welcome, welcome. Supernatural Nisi. Welcome, welcome, Loli. Good to see you. How about the people on Facebook and YouTube? Say hi. JMP07, welcome. Shim117, welcome. Anita Carell, welcome. Good to see you. This is Dr. Magarelli, CNY Fertility, Colorado. Today we're going to be having a nice discussion on question and answers. Next week we're going to be talking about twins, triplets, quadruplets, all those wonderful things that everyone asked me for. Oops, poor connection. Why is there a poor connection? Hang on here. You guys still are okay on that side, Melissa? Yes, looks like we got a poor connection here. I'm not sure why. Let me go back live with my Instagram here. Discard that. Go back here. Live. Let's go live. Okay. Hello, Claudine. Hello, Melissa. Kendi Osborne. Welcome, welcome. Krista Kruger-Pullen. Hello, welcome. I hope you guys are reading me here. Hi, everybody. This is Dr. Magarelli again. I apologize. There was some communication issues with my Wi-Fi. It seems like it's going in and out. I apologize. Welcome. Hoping for a baby. Amber Kelly, my dear daughter. Hello, my dear. Good to see you. April Dawn Coleman. Adelie V, nice to see you. IVF Still Hope, still there. All Things Health, there you go. Candy 980. Adelie, welcome, welcome. You know, I'm not sure what's going on with the internet connection. I hope it's going to stick with us. It seems fine with the iPad here, but my computer here is acting a little funky.
Sorry, I'm having trouble hearing. Can you say that again?
Well, that's my Alexa. It's talking to me. Cancel. Okay, what do you think of the ERA? Dr. Corley isn't crazy about it. Well, the endometrial receptivity assay is an assay. Someone else is trying to do a CNY live on Instagram. Well, yes, I do CNY live on Instagram, YouTube, and Facebook. So I hope it's not another Dr. Magarelli. It should be only me, Michaela. But the endometrial receptivity assay is used to detect the optimal timing for transfers. Now, it's good. It's useful in about 25% of cases, but not really 100% of cases. I tend to use it when we have a failed transfer for a euploid embryo. And so when we fail a euploid embryo, we kind of want to look for little things. Now, I'm not seeing any feed from the Facebook group here. So if you can say hi here, I'm not seeing any. It seems like it's frozen here. I'm not seeing any changes here. Anybody there? Oh, here we go. Hi, April. Thank you. Let's see. 7 weeks ended in miscarriage last week. Heart stopped. Had a DNC Thursday. We'll still have 12 embryos in Buffalo. Once my period becomes back, can we jump back in? Yes, you should. Hello, everybody. Thank you for checking in. Thank you. Thank you. Hey, Nikki. I didn't catch your questions. Can you take probiotics during the 2-week wait after transfer? Yes. Doing my first IVF next cycle, December, doing a mini IVF, kinda Osborne. Okay, Melanie, I'm listening tonight. Good. Nikki, hi from Facebook. Thank you. Brianna Monahan, hello. Trina, hello. So 2 PGTA normal embryos, both frozen embryo transfers failed back to back. Was still told ERA isn't necessary. I disagree. I actually disagree. I think you need to find out why you're not the implantation is not working. And the whole goal in what we do is to efficiently get you to a pregnancy. If you fail with one euploid embryo and you fail another euploid embryo, look for a reason. Don't hold on to those embryos. Look for a reason. Andrea, how long would you recommend to wait after getting the COVID vaccine to start stimulation? Probably, certainly 30 days should be more than enough. Ashley, and thank you for getting the COVID vaccine, which we at CNY strongly recommend everyone take the COVID vaccine. Nikki, I only have high estrogen on day 3. What does that mean? CNU says I'm ovulating, but still no pregnancy. I'm not sure what you mean by high estrogen, Nikki. I'm not sure about that. What's the difference between a grade A embryo from a 40-year-old and a 25-year-old? The grading of the embryo, you'll hear me say this constantly, has really no correlation with outcomes, or very little correlation. So the goal there is that if you have a viable embryo, transfer it. If you're not sure if a viable embryo is making it, meaning you've gone through, then you should have chromosomal testing because there may be a chromosomal abnormality. What is the success rate for mini IVF with PCOS? Mini IVF, kind of Osborne, is really reserved, I think, for folks with low ovarian reserve, certainly not with people with PCOS, at least in my opinion. Mini means less medication, therefore less eggs, fewer embryos, fewer chances. So in some cases, you never make a lot of embryos when you have low ovarian reserve. So it's worthwhile in those cases to just use less medication and save you money. Jesse, can you choose the sex of the baby? Yes, you can. Ash loves bacon. Okay, when I have tracked ovulation, I go from no ovulation to peak. Is that normal? Yes. Yes. Again, things are kind of wonky here. I apologize. I had hysteroscopy and D&C already. 2 failed PGT FETs in a row. What can I do to try to find out why it failed? This is Sarah. Are you doing acupuncture? Have you added growth hormone? Have you done a PRP wash? Have you done an HCG wash? Are you doing low carbs? These are things that you can do. Kind of Osborne, my issue is anovulatory and in irregular periods. So you certainly don't need to do IVF. You can do ovulation induction IUI. If you, by the way, do gene testing on you, it means nothing regarding chromosome testing on your embryo. So if you do gene testing on you, that's great. Find out if you're a genetic carrier. But if you want to know if your chromosomes of the baby, which is the building blocks of that baby, are normal, then you have to do PGTA. Naya, 3 of 9, good quality. What is the success rate for this embryo? Don't know. You have to tell me your age, your history. This is Nina. Taylor, I had 6 weeks and 6 days pregnant, and I had an ultrasound today. Everything looks great. Got to see the heart. Yay. Later that night, I started to spot some red blood, but mostly brown. Is that something you see a lot? Absolutely, Taylor. I've been told it's completely normal, but it's nerve-wracking. Any bleeding in pregnancy is nerve-wracking. So it's really fluids, hydration, rest, and even the ultrasound itself can cause you to have a little bit of a discharge. Andrea Hodges, how can I get a sooner appointment for follow-up so I don't waste a cycle? HCG was negative on Monday after ovulation induction with trigger and timed intercourse, waiting for cycle day 1, but no changes in protocol for follow-up. So how do you get a sooner appointment? You should be able to call, well, I don't know, tell them you're willing to go on a cancellation list. Well, kind of Osborne, the reason they recommend a mini for you is you're probably very young, and they're just what they mean is they're giving you a low dose treatment. Don't worry about the name mini. It has no obvious meaning other than someone named it that. It just means less medicine, and you probably will need even less than mini medication. Ebony Gay Man, welcome. Crumbs version 2. Hold on, let me talk to Dr. Kills for a second here. Hey, Dr. Kills, can I call you back? I'm on live, Facebook Live. Just say hi to everybody. Okay, that was Dr. Kills just saying hi. How do you guys handle allergens, food and drug? We don't handle allergens, food and drug. Andrea Hodges, I'm on cancellation. Sorry. You're 34 years young. Now I'm taking baby aspirin. What is the success rate? I would, again, it's either 100% or 0, Nina. It's 100% or 0 for everybody. My uterine canal is clear, but I have calcified fibroids. What are my chances? Veronique, well, the calcified fibroids are not going to impact your pregnancy unless they're inside the uterine cavity. Lisa, I'm 30 with irregular cycles. I have elevated testosterone and low progesterone. Sounds like PCOS to me. I've been having a hard time conceiving since my first daughter is 6 years old. Anything you suggest? Well, yes, you're a good candidate for metformin. You're a good candidate for ovulation induction IUI. You're a good candidate for IVF. You got lots of options. J and B makeup. Sorry, I missed it. Candy, did a transfer on 11.5. First beta was 13, but I'm taking HCG boosters. Do you think all the HCG levels are from the boosters? No, Candy. If you took it at the right time, it might be, but just follow up in 2 days. I have PCOS but low AMH. FSH is good. Would a mini IVF be what is recommended? No. It depends on your age. My first IUI, 1 IUI, 5 PGT transfers. I made it to 6 weeks. No heartbeat. What else should I try? That's a little too broad. There's lots of things you can try. Is everybody getting sound? Oh, that's right. I've got to start and stop this. Hang on a second, guys. Sorry about that. Excuse me, guys. Every time somebody calls me in the middle of this, I get, it knocks out my Instagram live thing there. I'll have to make sure and shut this off here. Okay. Julia, not sure if anyone already asked. I heard that in December you cannot do PGR because Cooper is closed. You know, I have no idea, Julia. Bria, if I had a bilateral fimbrianectomy, tubal ligation, can I get a tubal reversal? No. Is bleeding normal around week 5, day 4? No, bleeding sometimes means dehydration. Bleeding sometimes means trauma from intercourse. Bleeding sometimes could mean risk of miscarriage. Keep yourself well hydrated. Make sure you're taking your progesterones and avoid intercourse for a little bit. Have my consult in February, started Dr. Kilt's keto, taking all my vitamins, had blood testing, HSGs done. Plan on doing acupuncture. Oh, God. Allison, it looks like you're doing everything. Would going straight to IVF be the right choice? Yes. How many miscarriages did you say? Yeah, IVF with PGTA testing. I would definitely do that. Acupuncture, you've already mentioned. Low carb. Is there a correlation between a positive pregnancy and estradiol and progesterone levels? For example, are they high or low when a positive and there is no correlation? A positive pregnancy and estrogen, well, we tend to see elevations in progesterone levels when you're pregnant. Is there an IVF protocol for a recurrent pregnancy loss? Yes, we use, Dr. Kilt has developed the various CNY immune protocols. And if you truly have had recurrent pregnancy loss, make sure it's not mechanical. Make sure you're doing acupuncture. Make sure you're avoiding carbohydrates. You know, and yes, there's many protocols for recurrent pregnancy loss. Kristen Pullen, of course, hello. First retrieval, we only had 3 eggs and currently in and out 2-week wait for our last embryo. Should we go through another retrieval? Yes. How long would you have me prep with Omnitrope to help with growth? 40 years old and AMH of 2, at least 18 days, Kristen. Ashley, been time to conception for over 3 years trying to conceive. Had 3 IUIs. We have a consultation in December. Yay! Is there any advice you can give to us before we start the whole process? Yes, everyone. Download our brand new updated family building guide from our CNY fertility website. Go to the resource page. Start alcohol, reduce or eliminate alcohol, tobacco, drugs, male and female. Make sure you're taking your nutraceuticals. Make sure you start your acupuncture early. All of you, you know, I support the use of Serovital as a growth hormone secretagogue. Fundamentally, it enhances endogenous or self-growth hormone. I would recommend that. You can get that at Costco on sale right now. I just bought 6 boxes for myself because I'm getting old, but certainly it's good for eggs and sperm. What does avoiding carbs help implantation and avoid miscarriage? Why does it? Because inflammation caused by excess carbohydrates causing insulin resistance, causing excess hyperglycemia, causing impairment in the normal biologic processes can interfere with implantation. Key knee watch Scott. I am 35 and had a chemical in August with a 3-day embryo. Would you recommend growing embryos to day 5? Now, I do recommend growing embryos to day 5 in most cases. However, if you have very few embryos, put them in on day 3. At least you get a transfer. And if they're going to stick, they're going to stick. I do recommend IUI with letrozole. That's what I do recommend. I just wanted to tell you, thank you. You did my transfer back in January after 3 years, we had our son. God bless you, Danielle. Thank you so much for telling me that. That means a lot to me. Thank you. Should someone with low AMH avoid myo-inositol? No, actually, not at all. Those are not correlated barefoot in the woods. Marlise, wife had a miscarriage and had to take methotrexate. How soon can she do another IUI cycle? I would wait, not the next cycle, but the cycle after that. Welcome back, Stella-Licious79. I recognize your picture there. Good. Those are the things that I'm thinking here. Okay, that seems to be fine. That seems to be fine. I'm in a freeze-all stim cycle. That's his cat. I just found out I have fluid in my uterus, blood or blood clot possible, hyperechoic. What would this be? Is it bad? Well, if you're in a freeze-all stim cycle, then don't worry about what's in your uterus. We don't need to put anything in your uterus, and my guess is it's just secretions from your enhanced estrogen. What's the reason to add letrozole for stimulation if already using gonal? There isn't a reason, Andrea. It's a protocol, but there's not a reason to do it. There's no reason that I can think of. It is useful it has been shown to be useful in patients who are over 40 with low ovarian reserve in rare instances, but generally speaking, it's not something that I do in my practice. CC Polish Me. Had 3 ectopics. I no longer have any tubes. How long before I can start IVF? Immediately. What causes low ovarian reserve? Your mom's X chromosome, exposure to radiation, exposure to smoking. Those are all things that can reduce ovarian reserve. Hypothyroidism from Hashimoto's hypothyroidism can do it. Mild endometriosis that wasn't addressed prior to FET. It was normal embryo and failed transfer. This has been a reason why. Could this have been a reason? Yes. So J and B makeup, I would strongly recommend you get a operative laparoscopy to treat the endometriosis. Misty, I have peace. Hello, Josherman. Dr. Banerjee's on the scene. So now we have a smart man on the scene, so he can jump in anytime to answer the questions for me. Dr. Banerjee, I'd appreciate it. Dr. Banerjee, as you know, is part of our CNY family of amazing doctors, along with Dr. Fink and many, many others, Dr. Kiltz, Dr. Corley, Dr. Ditkoff. We have an amazing crew, Dr. Chang, Dr. Verdialis, Dr. Kondrup. I mean, the names go on and on. Let's see, I have PCOS and haven't had a period since 2019. Not a good deal. When you have PCOS, you have to either be pregnant, on birth control, or have a period every 2 months. If you do not, you're at risk for endometrial hyperplasia, and endometrial hyperplasia puts you at risk for endometrial cancer. So please make sure you do that. Allison McClure, her consult is with Dr. Banerjee. You are so lucky. Okay, haven't had a period since 2019, getting a gastric sleeve surgery in January to help with weight, diabetes, and high blood pressure. How soon after surgery can I start seeking fertility help? I would say certainly within 6 months. I don't know how old you are, but I would say within 6 months, but talk to your surgeon. Alex Millengolf, we need IVF due to MFI, male factor infertility. Okay, but I have quite a few drug and food allergies. How can you optimize IVF after reactions to letrozole and Avadrol during IUI? Well, we don't use letrozole during our treatments. That's too broad a question. I'm not quite sure I can easily answer it. You're 34, Laylee. Yeah, I'd say 6 months even would be fine. Misty, I have PCOS and only one ovary. What's the best option for you? Misty, tell me how old you are. So Dr. Banerjee says, great. She'll be talking to you, Allison. Is it barefoot in the woods? Is it better to plan a natural FET so that the corpus luteum can make the progesterone? No. It is not better. There's nothing better about doing natural. It's just simply another way of doing something. As you all know, for me, the whole idea is use our technology to speed in the implant and enhance the implantation process, etc. So I'm a big proponent of medicated cycles. Is there a certain BMI for IVF? Not in our practice, Kaylin. The American Society for Reproductive Medicine says it's not really ethical to keep people from getting care based on their weight. We do not turn anyone away. TTC, the unplanned journey, had my transfer today with Dr. Fink. Any advice for the 9-day wait? Acupuncture, prayer, all good things. Talk to people. Misty Boggs, you're 38. I have PCOS and 1 ovary. IVF. Misty, IVF. Kinda Osborne, we're back to you. If I had a failed IUI back in August, they said I had a cyst on my ovary. I'm doing a mini IVF cycle in December, or should I do an IUI again? Do the mini IVF cycle. What do you recommend? What do you recommend? I have irregular cycles and yeah, I think IVF is probably more controlled for you, and it looks like you've been working hard to achieve a pregnancy. And I forgot how old you were, but probably worth doing IVF. Hello, butterfly, unicorns, and unshine. Shim117, welcome. Carla Rodriguez, how important is the cycle day you transfer for a modified natural cycle, even if you have a follicle size 17.5? As I said to everyone, I'm not really much into a natural anything cycle for your technology, so I'm not sure I can answer that. What protocol is good for someone with autoimmune? Well, the protocol is the immune protocols. So I would look at the immune protocol 3 or 4. You can download our family building guide. I recommend that strongly at the CNY Fertility website on the resource page. Carol 9919. On my way to WWF to transfer Harold and 1/2 way beta 2. I don't know what that means. On my way to 2WW after transfer. 2-week wait. 1 out of 2 way beta 2. I don't know what that means. Anyway, I wish you luck. I've heard that retrievals for higher BMI women demand special equipment. What kind of equipment is that? It's to be able to intubate you in case something happens when you're asleep so you don't die. So, and we also special videography to be able to look at your vocal cords for the airway. And you have to have the ability to do resuscitate. So you have to have resuscitation equipment, oxygen, or certainly suction, or certainly. You have to, lots and lots of things, my dear. Andrea, how long can you be on growth hormone before starting stimulation to be safe? There's no unsafe with the growth hormone, but 18 days is a good amount of time to do. Oh, okay. Hi, I have my first phone conference tomorrow with you all. So excited. Jarrett Thompson 4. Well, welcome on board. Is Myo and D-chiroinositol okay to use with letrozole? Yes. Yes. Okay. Looks like we're slowing down, people. Well, again, I'm Dr. Magarelli, CNY Fertility, Colorado. I think my good friend Jeffrey is online here. I don't know if he is or if he hasn't identified himself or he hasn't figured out how to come on. Hello, Jeffrey. My dear, wonderful daughter here is online also, which I appreciate. Hello, my dear. And of course, my good friend, Dr. Banerjee, is online. And again, our goal here at CNY is really give you the kind of information so you can make good decisions. Your decisions are important to us and your thoughts are important. But I do want to tell you it's critically important that you also listen to the physicians in terms of their advice. Their advice is how to get you there quicker and faster and safer. And I know on the internet it tells you to do this, that, and the other, but at least trust your docs a little bit to know what's best for you. Trunigan NAD+, do you recommend it? No, nothing about it, Carol 9919. Hello from CNY Sarasota, Jessica. Good to see you, Jessica. Hello. As you know, we opened up the wonderful office in Sarasota, Florida, finally. How exciting. Brooke, 32, 1 live birth 7 years ago, had 4 miscarriages, 3 IUI treatments, going to do IVF in Colorado. That's me. Is the extra genetic testing recommended? Yes, if you've had 4 miscarriages, yes. Elaine, I'm very glad that you answer our questions. Thanks for your advice. I bought some Serovital. Thank you, Elaine. I hope the information we give you is helpful to make good decisions. This is a complex emotional journey. No question about it. Complex and emotional. And for a lot of you, and I hate to use the term, but you feel desperate about getting pregnant, and I get it. But you don't also want to make lifetime mistakes. I mean, many of the folks, oh, please put in 2 embryos, 3 embryos, 4. Oh, no, I've read the data. I can put in 2 euploid embryos. You really are not reading the data. 1 euploid embryo is about equivalent to 3 untested embryos. So putting in more than 1 euploid embryo makes no sense. Secondly, there's a 15% short-term and long-term hazard to the babies who are born twins, and much higher risk if you're triplets, quadruplets, quintuplets. I certainly, and many of us have put in 1 embryo and gotten triplets, put in 2 embryo and gotten at least quadruplets, if not octuplets. So putting in more than 1 embryo is not a benefit. In the old days when our technology wasn't very good, we had a pregnancy rate of 13%, then sure, that probably made sense in 1980s when I started. But today, with all the testing and the protocols and the immune protocols and the HCG washes and the intralipids and all the things, the growth hormone, really putting in more than 1 embryo. I mean, I know I'm grandstanding here, is really not safe, not good for the baby's environment. Trying to get 2 babies in one place, not good for society. Okay. And Elaine Troy says 1 embryo works. My first FET was almost a year ago. The baby is sleeping here in the living room. All right. I love it. Danielle, we transferred 1 back in January. I am a twin and wasn't risking it. Danielle, thank you. Claudine, is it possible after 5 miscarriages and 3 DNCs, endometrial receptivity goes down? All those pregnancies were spontaneous, but now I may not even get pregnant with IVF. Last time at donor egg. Well, Claudine, I'm likely older. DNCs certainly will impact the endometrial lining. So think about getting maybe PRP washes, which can help you rebuild. Have a good evaluation. Hysteroscopy, folks out there. HSGs, HSSs, hysterosonograms are okay, but the gold standard to evaluate your uterus is a diagnostic hysteroscopy, 3 to 5 minutes in our office, or your doctor can do it. But definitely worth doing, so I would do that. Jasmine just came off progesterone after first failed at day 3 fresh. I'm heading back to square 1 after cycle starts. Would you recommend pushing to blast next time? Yes, if you have enough embryos, which is 4 or more embryos, grow them to the blastocyst because it teaches you about that embryo. Fataromo, after a failed FET, does your professional opinion change for transferring 2 untested embryos for a second FET? Yes, it does. Everything matters. But I'm getting a lot of young 20-year-olds who want more than 1 chromosomally normal embryo, and the risk is enormous. And as you get older, the chances of the embryo sticking goes down, even if it's euploid. So, and if you have failures, of course, the American Society for Reproductive Medicine says consider that in your decision making. How do you determine what protocol to put a patient on whose AMH is 0.1? Well, Nisi, it's pretty darn easy. You're on a low ovarian reserve protocol, the mini IVF protocol with growth hormone, Serovital, acupuncture, low carb eating. Those are things that I would think about. You're welcome, Claudine. Crystal had a right ovary removed and tube cleared to uterus due to endometriotic cysts. Ended up with a hernia in lower left abdomen right next to the pelvic bone. Mesh to repair. Would IVF be a good idea to try to get my pregnant, or should I hang up my body baby making? No, I don't see any of that unless your doctor doesn't want you to get pregnant. I see no reason. Next to the pelvic bone. No, I don't see a reason why you can't get pregnant, but you might ask your gynecologist. Yeah, at least from my standpoint, I don't see a particular concern there. Oh, good. It looks like my Wi-Fi is back. I just decided to come back. Hello, Kelly Eileen. Welcome aboard. Nicole DeLuca Owen, nice long name. Welcome aboard. Let me take a sip while you guys are thinking of some questions. All right, everybody's quiet. Okay, what else can I talk about? Well, we're really hopping here down in Colorado. Our practice is maturing. We've been with CNY now a year and a half, and a little more than that, and we're growing remarkably. And the way Paige goes, hello. And so we got a more mature staff. You know, you have the growing pains, which we had for the first year, but I think we're ironing out a lot of them. The facility, definitely, we're now the bottom and the top floor, so about 14,000 square feet of space. We're here. We still have plenty of space for patients to do IVF. So, you know, essentially, you know, if you want to move fast and ahead, don't. You could certainly give us a holler and say, hey, I want to do it in Colorado, or just ask the question. Okay, Andrea, can you take Serovital for a couple of months if you're already using growth hormone? Yes, absolutely. Serovital helps your own body produce growth hormone, and of course, exogenous growth hormone helps. How soon can I do acupuncture after frozen embryo transfer? Within 8 hours. And then keep doing it. Jackie, Veronique, what's a good protocol for a 50-year-old doing donor with high blood? Now you lost me there. Now all these questions are coming in. Time to conception, 6 years. Time trying to conceive for 6 years. 1 chemical, 1 natural, 3 unsuccessful IUIs. Gosh darn it, folks. All the questions are coming. A lot of questions coming in. By the way, I can't answer every single person's question. I know, and so I'm trying to make sure everybody gets a chance here. Diagnosed with unexplained, what protocol would you recommend? 6 years, chemical, natural, 3 unsuccessful. Well, Jackie, standard IVF. Vicky, follicles been growing on Orlissa protocol to 10 and 12, and today 12 went down to 11. Any thoughts? You need more food. The Orlissa is not a fertility drug, so it means you need more gonadotropin, some sort of fertility medicines. Sharon, I'm 31 years old. I've had 3 failed transfers. I recently had a laparoscopy and hysteroscopy. No endometriosis, however. I did not have a flat polyp and some micropolyps. I'm currently on endometrial. Should I also do an ERA before my sex transfer is the likely cause of my... Yeah, it's likely, Sharon, that the polyps caused your problem, okay? Carla, well, let me get a Scorpio, baby. I'm 21 and I want to do IVF before June 2022. I want to have a successful transfer. So how do I rule out endometriosis? Well, you'd ask for a diagnostic laparoscopy. How long does the normal IVF process take from start to finish, including genetic testing? 3 months. Can you take Omnitrope to prepare before starting over? Yes. Also, can you take low-dose naltrexone? Yes. I'm aiming for a January retrieval. Do I need a full 30 days of Omnitrope? You need, Heather, you need at least 18 days. Kinda. Trying for 6 years. I have 1 live birth. He's now 7. I was on Depo shot from March 2014. What is my success rate? I think, kinda, Osborne, I think you're in your 20s. It should be around 30%. I think kinda you're in your 20s. Okay, would you recommend PGA testing for younger couples as well? No. If I may suggest, this is Elaine, a future topic, I would love if you could explain exactly how inflammation is detrimental to reproduction. Let me write that down. The role of inflammation in reproduction. Okay. That'll be a topic. You guys can give me topics, by the way. The role of inflammation in fertility. Okay, I can do that. Actually, I'm interested myself, actually. I'm 21 and want to do IVF before. Oh, yeah, we already said that. Scorpio, baby. Okay. Oh, let's see. Larfine joined us. Welcome, Larfine. And kinda Osborne, I hope I answered your question there. I think I did. Unrelated to the Q&A, but I just wanted to mention financial department is swamped and isn't getting back to us. I have been calling and emailing for the past month. Thank you, Claudine. I did not know that. I will be meeting with the financial person Thursday. So financial swamped. I had not heard that. By the way, has anyone else had the problem with financial getting back to them? It should take 2 weeks to get back to you. Pretty typically about 2 weeks. By the way, Kim Mercado Mixi Trice, doing the Omnitrope, it's called priming. It's called priming. All righty. Yeah, I don't know if my internet is spotty, but okay, we're back. What is a protocol for a woman who's 48? The protocol typically would be a mini IVF protocol with growth hormone, acupuncture, serovital, and the chances are less than 5% that your own eggs will create a baby. And that's just not yours, but anyone over the age of 44, the challenge, this is per cycle. So even a 20-year-old will take 3 IVF cycles to make a baby in the United States. So you would imagine a 30 would take you longer and a 40 take you even longer. Depo Provera, irregular periods, it depends if it's, usually Depo Provera can mess up your cycle for about 18 months. So if it's been less than 18 months, the answer may be yes. Or the reason you're on Depo Provera may be you may have hidden PCOS, polycystic ovarian syndrome. Glenda Torres, oh my gosh, the chance with a donor egg, I guess I should have mentioned that, could be as high as 80%. So the difference between using your own eggs at 48 and donor, it's the age of the donor. So you'll get a donor typically who's younger than 30 years of age. So absolutely, that would be the optimal way to go, Glenda Torres. Oh, Iris Eyelash Studio. Okay, we got a studio. Laura Fien joined us. Hi, KBSBM joined. Hello. Welcome. We're cooking on about half an hour into the show, and if you have any questions, just throw them out there. Do you recommend, Nicole, doing a fertility test before an initial redoing fertility test, or wait till after the consult to get the test? I would do recommend if you can get the testing. Now, if you want to know what tests are important, download our family building guide, and there's a list of tests that we'd like to have current within 6 months to a year of your intended treatment. Not in your intended consult, but when you get treated. So definitely, if you can get those tests before and have the results, that will speed up getting you to treatment. Can high ferritin in males affect sperm quality? I don't know the answer to that. High ferritin. Boy, today I have lots of things I got to write down here to remember. Elevated ferritin and sperm. Yeah, interesting. Thank you. You're welcome, Nicole. I think I've recommended this about 3 times to you, IVF. So IVF is the recommendation in your circumstances, but also get a consult. Kimmy, how would high testosterone levels in females affect a transfer? Well, not so much a transfer typically. Although if it's extraordinarily high, it may affect implantation because testosterone may have progestogenic effects. Do you think testing embryos that have already been frozen is worth it? Yes, Nicole. Absolutely, I do. If you need to, which means you've not been successful with the transfers so far, yes, test the rest of them, make sure they're chromosomally normal. All right. Does a hysteroscopy affect the menstrual cycle, Lydia? Not likely. Maybe immediately, but not likely. JJ103 and Laura Jocelyn, welcome. The success rate for IVF with low morphology, if everything else is great for women. Well, Nicole, you have to tell me how old you are. That determines the success rate. The morphology of the sperm, I'm assuming. The success rates for IVF with low morphology sperm, I think. And you had only 1 transfer that resulted in a chemical and have 12 embryos left. Yeah, I would test them. 32. Morphology is not really going to make a big difference for you guys at 32. Coming to your second transfer on Friday. Yes. Okay. Low morphology sperm. Got it. All righty. Priscilla, hello. Sarah Portillo. Hey, by the way, folks, I think there's a little bit of confusion for maybe some of you who are just joining us. I start my lives on Tuesdays at 4 p.m. Mountain Times, which of course is 6 p.m. New York time and 3 p.m. California time. And you guys can figure out the rest of the time. And we've now fixed that on the internet there. So it's at sort of about 20 minutes more tonight, just as an FYI. What supplements you can take to help equality, Shonda? Well, I like the Zero Vital because of its impact on growth hormone. I do like, people talking to traditional Chinese medicine doctors, especially those trained in the American Board of Oriental Reproductive Medicine at the Healing Arts Center in CNY, because they're really focused on fertility, and they really know supplements and herbs, and very special. Not all herbs, and not all people can take the herbs. When is hysteroscopy necessary? I believe that hysteroscopy should be done for anyone who's going to do an IVF cycle. It's a very quick procedure, and the key thing about it is it's called the gold standard for determining if the uterine the anatomy of the uterus is normal. So I know you can get HSGs and HSSs easily, but if you can get hysteroscopy, it's better. Do you recommend PRP? Is there something that is frequently considered for failed transfers? Kimmy, it's not frequently considered, but it really depends on the uterine lining. If it's not growing, then you might consider it. What is the goal for progesterone and estradiol for day 5 post-embryo transfer? I don't have a number. It's just the presence of it, so treat yourself. Make sure you're treating yourself. Kate, my follicles are well synced but slow. What is the optimal trigger size? 17 to 20 is the range. I like 18 in Colorado, but it might be 17 on the coast. All things health. Unsuccessful fresh transfer, 7 weeks. Frozen embryo transfer, miscarriage, low AMH, 40 years old, fibroids. What do I recommend? Miscarriage, low AMH, 40. Well, continue with IVF. Even 20-year-olds take 3 IVF cycles to make a baby, so you might want to do genetic testing if you have enough embryos. Hello, Tiff Crow Kid's mom. Okay. How long after positive beta do you have your first ultrasound? Well, it's about, let's say, 10 to 14 days. Melanie, I'm 36, always been healthy with regular cycles, had 2 IVF cycles, no embryos. Great embryos round 2, but it didn't take. Is it really best to just keep trying over and over and hope the percentage of success gets closer and closer? Melanie at 36, acupuncture, serovital, growth hormone, low-carb diet. These are, if you're doing all of those, then you do an endometrial receptivity assay. You'd make sure you rule out endometriosis with a diagnostic laparoscopy, but make a lot of embryos, put them in the freezer if you have to. Marisette, finally getting a laparoscope next Friday. How soon can I start priming? For what? Marisette. I'm a little confused how you're relating laparoscopy with priming. Thanks, JJ103. I am 6 weeks, AM6 was pregnant. First beta, second beta, third beta, did not test. Still praying I bring home this baby, 42 years old. So you have to have had an ultrasound, my dear. If your third beta is 5,000, get an ultrasound yesterday. Oh, you're 6 months pregnant. No ultrasound is necessary. Oh, yeah. Well, good luck. Good luck. I hope that works. 6 weeks pregnant. Okay, again, the blood work is not going to help you. As long as you have an ultrasound, make sure everything is okay. That's what I would recommend. Continue with your progesterone, probably to 12 weeks. Baby aspirin, probably to 20 weeks. If doing 2 embryos, can they be different days? No. Melanie, I'm 36. I've always been healthy with regular cycles. Oh, yeah, I've already said that. How long after a positive beta do you have your first ultrasound? I already answered that. Tiff, retrieved this morning at last ultrasound visit. We only had 2 follicles today. I retrieved. We got 7 eggs. Thank you all so much. Our pleasure. You gave me hope. Yeah, well, thank you, Tiff. We really appreciate you being here. Mara said, I meant priming for my third IVF attempt. Got it. So yeah, you can start priming right after your laparoscopy. Absolutely. Absolutely. That's with growth hormone, right? Mara said. Okay, time for a sip of soda. This is Dr. Magarelli, as you know, from CNY Fertility, Colorado. Happy to be here. Happy to answer your questions. Shout out to all those wonderful, wonderful nurses out there, wonderful, wonderful embryologists and lab technicians and financial folks and front desk folks and our custodians, our cleaners, the other doctors, the nurses, the on-call team, the global travel team, the donor team, nurse practitioners. You guys just are fantastic. And really appreciate you creating this wonderful environment for all these wonderful folks to get pregnant. Nicole, will you be doing transfers on Friday or Dr. Fink? I don't know. We work as a team, a tag team, and we want to get the work done. We don't want you to wait. Oh, thank you, Tiff. I'll tell my team that you really enjoyed the folks here at CNY Colorado. I will actually be joining them for dinner tonight. I'm taking my nurses out to dinner just to thank them and talk to them. Elaine Troy, my compliments to Dr. Credenda. She's as our CNY Integrative Medicine Manager. She's an acupuncturist. I followed her advice from Acupuncture Session Online. Will you already know the transfer was a success? Our own egg husband worked. I'm over 40, by the way. So Elaine is talking about Dr. Diane Credenda at the eastwindsacupuncture.com. And if you're anywhere out there, the Colorado Springs Independent is doing a voting for the best acupuncturist. So it would be nice if you guys vote for her. Go to the Colorado Springs Best of 2021 and look up acupuncture and put her East Winds Acupuncture in there, or Dr. Credenda would be great. She's also my wife. She and I created the Credenda Magarelli Acupuncture Protocol when long before she was my wife. We've known each other for almost 20 years. Research led to romance, and so now we're happily married. But the key thing is that she helped create the American Board of Oriental Reproductive Medicine, as did I. Our goal was to get certified, trained acupuncturists in the world who specialize in treating infertility patients, especially IVF patients. So yes, the acupuncture, it's 9 treatments before your retrieval and 8 before your transfer. And these have been studied, and we've done publications and presented abstracts as well as oral presentations around the world. So adding acupuncture as a way of enhancing both the recruitment of follicles to the implantation, to the reduction in miscarriage rate, to the almost elimination of ectopics, is just worth it. Read about it. You can go to eastwindsacupuncture.com website. Lots of information there. Go to our website about acupuncture. We strongly recommend it in the CNY family. CNY itself has many healing arts centers. So it's definitely something to think about. Read about it, study it, ask questions. All righty. Eugenia, hello. Had a recent retrieval last Wednesday, which resulted in 1 blast. I'm 39 with PCOS, and after retrieving 20 eggs, but none following all the way through due to egg quality. Should I put a lot of hope into the one that made it? The clinic is not giving up on me. The clinic is not giving you a lot of hope, Ms. Parker. Well, it's not I don't know what clinic is not giving you a hope, but you give yourself hope. We will give you hope. 1 egg, 1 embryo, 1 baby. I would strongly recommend making more embryos. Get them in the freezer. It sounds like make sure you add growth hormone, Vital. Avoid anybody who's smoking, husbands included. Those are all critical things you can do. All righty. I had a ultrasound with a fetal heartbeat. Congratulations, Jamie Yolasunk. And 3 days after with a PGT, 6 weeks, 3 days, miscarriage rate is now low. After a heartbeat, yes, there's a 90 to 95% chance of going to term. Hello, sweet Kabul and Exo Katie Smith and Amiamo, Ammo, or Amiamo. I don't know. Hello. When do you recommend a mini IVF protocol versus a standard? For women who are over 42 or 43, low ovarian reserve, or women who've had very hard time getting eggs at all. They will help. They'll be helped. Why would embryology choose a 6-day and a 7-day for me if different day embryos are not done for FET? My FET failed. Is that a reason? No. By the way, the terms 5th, 6th, and 7th day of blastocyst are meaningless. Those are just a clock. What we're looking for is the development of a blastocyst, and it may take 4 days to get it to a blast. Most days, on average, it takes 5 days to get to blast. Sometimes 6 days, sometimes 7 days. So we no longer use the term day 5, day 6, day 7. We use the term blastocyst simply because it confuses people. Yeah, I hope I answered your question. Good, Nicole. My job is to help. How many times would you try IUI before moving on to IVF? Well, the studies say do 3 and then review with your doc. Do another 3, and if you still don't get pregnant with an IUI, move on to IVF. That's what the studies show. But it depends on your age. Amiamo. Okay. Depends on your age. Really good questions, good interactions today. Thank you, everybody. This is Dr. Magarelli, CNY Fertility, Colorado. It's getting dark out now because it's winter. So I'm out in my little room off the bedroom here. It's a little studio I put together here. Lee Thompson, how about 32, 33? That's a great number. What does that mean, 32, 33, Lee? Sorry, I can't remember all of the previous questions. So does that mean you're 32 or 33, or what's your question? I apologize. I don't, let me see if I can scroll back. Nah, too many questions in between. So Lee, ask your question again. What exactly is a 3-day embryo? Can you become pregnant with them? I don't know what a 3M embryo is. I'm assuming that's a day 3 embryo. I don't know what 3M means. So am Tanya. Hello, 35 pineapples, Curulazololo, Unique joined. Hey guys, just so you know, this Facebook, Instagram, YouTube live starts at 4 p.m. Mountain Time. Now it's almost 10 to 5. So it's 4 p.m. Mountain Time every Tuesday, 4 p.m. Mountain Time. Every other week, I typically will do a lecture. Next week, I think I'm going to be talking about twins, triplets, quadruplets. Okay, Lee Thompson. Wife is 32, going on 33. You said 3 to 6 cycles, depending on age. Got it. Okay, so yeah, I would do 3 cycles, Lee, and then I would definitely consider moving on to IVF. Because typically as we get older, especially closer to 35, the rate of egg loss accelerates dramatically and you just don't want to lose eggs. Hello, Balon 13, too classy. Hello, Curl Z Lolo, 35 pineapples. Again, I want to remind you this starts at 4 p.m., not 5 p.m., 4 p.m. Mountain Time. I don't know where you guys are from. To Jana Shell, again, welcome. I'm Dr. Magarelli, CNY Fertility. I do these at 4 p.m., so it's about 10 to 5 now, or 8 to 5 now. So just in case you guys don't know, so next week you can come in at 4 p.m. Mountain Times. Anything I can do for SH? I am 10 weeks pregnant for a subchorionic hemorrhage, Ashley. Well, relative bed rest, fluids, and rest, Ashley. Those are seen a lot. I see those a lot. You're at 10 weeks, got a heartbeat, got a better than 95% chance to get to term. Ariana Williams, I'm not sure if you saw my question. I had to take a call, but is it possible to have an egg retrieval for high ovaries? Yes. Best advice in healing from an ectopic pregnancy? The best advice is, kind of high protein, moderate fat, low carb, until you heal. Natalie, do I need estrogen in addition to each month at 30 with a low ovarian reserve? Oh, I'm sorry, to estrase, even though I didn't need it last time. I don't know, Natalie. I would have no idea, Natalie. I would have to look at your chart. Lee Thompson, wife produces 3 to 6 follicles each month, at 32 going on 33 with a low ovarian reserve. Yeah, going back to your answer there, after three tries, I think I would consider IVF. Amiyamo, I have a fibroid, lots of scar tissue, and 1 block tube. Is IVF possible? Yes, as long as the scar tissue is not inside the uterus, and as long as the fibroid is not inside the uterus. Natasha Vinciencia, I see you're just joining us now, but we're just ending. So we start at 4 p.m., folks. So next week, 4 p.m., I'll tell my team to maybe advertise that greater to you guys. Lynn Christie, again, we start at 4 p.m. Do you recommend removing blocked tubes? No, I do recommend if you have a hydrosalpinx that you clip the tube but not remove them, because that's the blood flow is critical for your ovary to be fed the fertility hormones. So you don't want to do a lot of cutting and snipping on the vessels there. How is the egg retrieval done with high ovaries? You can do it through the abdomen. Or when you're asleep, guess what? They're no longer high. Everything relaxes. They go into the pelvis. So yeah, you can either do it through the abdomen, certainly have done that, or usually, and I would say 99% of the time, while you're asleep, everything relaxes and we can get the ovaries into the pelvis right next to the vagina. Advice for a successful frozen embryo transfer: download our family building guide, do acupuncture, traditional Chinese acupuncture medicine, do Serovital, keep on a low-carb diet. Lynn Christie, good evening. Can you tell me, please, what AMH is good for a 36-year-old and thyroid level pre-retrieval? No idea. No idea what's good. Sorry. I had my pension last week. I have 4 embryos frozen. I'm wondering what day I'll have my transfer. I don't understand that, Lolo. Would you recommend mini IVF for first round for patients with PCOS? I think I said that before. Not at all, Scorpio. Is 3M is a grade. So 3 is a good, M means morula. Well, I would recommend you do a blastocyst transfer. 3 is good. Well, there you go, Awen. I think that's the answer, whoever asked the question. Again, I don't think grading tells us anything. Is it not? Can you do IVF for uterine fibroids? Yes, as long as they're not inside the uterus. And the reason you don't want to do that, you don't do a thing such as, I don't get caught up on the titles of these protocols. Really, the physician, you ask them questions on why they're choosing whatever protocol. Don't tell them the protocol, because quite frankly, you don't have the frame of reference to know what even the protocol means. And protocols just means a way of treating. So if your physician is going to be treating you, ask them why that particular treatment makes sense. Is it possible to try IVF when your AMH is 0.3? We do it many, many, many times, too classy. Cat, besides OHSS, what is the risk of increasing the stim meds? Can it negatively affect quality? No, but in the past, again, research is always change. We're always learning something with research. In the past, there was a suggestion that high gonadotropin levels may interfere with the quality of the eggs. I don't think that data has stood up to the test of time. It's like old-fashioned thinking, But I think getting the right amount of eggs is important, and adding the right amount of nutrients or micronutrients or hormones are important. It is critical to make sure your thyroid is normal, your pituitary prolactin is normal. It's critical to see if you have excess androgens like testosterone, DHEAS. These are things that we know what to look for. Don't get stuck on a particular protocol. All right, this is going to be my last question because we're actually out of time. Cycle day 9 on stim meds plus antihistamines. Have endometrial fluid. Does it affect transfer? Yes, Rosin. Having fluid inside your uterus, but it depends. It's fluid inside your uterus after you've started your progesterone. If it's there before you start your progesterone, you don't have to worry about it so much. But if it's there after you start your progesterone, it will interfere with implantation. So that's not a good cycle to do an implantation. Anyway, this wonderful hour has just flown by. Thank you for spending the time with me. I really appreciate it. Thank you all for asking these crazy, amazing questions. I love them. We're going to do a little bit of homework on doing a presentation on how inflammation impacts fertility, looking up at ferritin and its impact on sperm. And then let me see if I can find out if the financial team is swamped and they're not getting back. Oh, good. Rosin loves me. Well, I love you all. Thank you. I appreciate you all, Claudine, everybody. Remember, always send me kisses. I love kisses. So those little kissy things that you get on Instagram, I love those things. And I appreciate you guys coming in every week. Please, if you have ideas for talks, please don't hesitate. There's another kissy on the Instagram one. Okay. You guys have a wonderful productive or maybe reproductive night tonight. We really appreciate your questions. Again, we start 4 p.m. Mountain Time. Ooh, there's a lot of kisses over there. 4 p.m. Mountain Times on Tuesdays. Every other week, we usually have a lecture and then questions. This week was just questions. And I thank you. I thank you for your time. Thanks, everybody. Be well. This is Dr. Magarelli, CNY Fertility, signing off.